Ask any parent what serves as their number one priority or love, and chances are the majority of them will have the same answer: their children. Most would give their lives if it meant that their children would live healthy and fulfilled. However, that cannot always be the case. Many children face challenges such as mental disabilities and medical disorders for their entire lives. For example, recent studies show that 1 in every 1,000 children are diagnosed with autism in their early age. Those affected deal with issues in areas such as communication, abstract reasoning, and social interactions, among others. Examples of symptoms found in children include avoiding eye contact, inappropriate attachment to objects, and over or under sensitivity to pain. This is a diagram that shows a PET scan of a brain with autism and one without. As you can see, the one with autism has much less functioning. However, not all hope is lost when a child receives a diagnosis. With improving medical and psychological studies, treatments and therapies for autistic children have greatly expanded. Though several approaches exist, the three main categories are behavioral, medical, and dietary interventions. The overall consensus I will discuss is that behavioral therapy works most effectively. Medication comes in second. Special diets such as gluten-free have proved mostly ineffective in most studies. Behavioral intervention usually begins at an early age to give a child maximum amount of tools to create lasting relationships. Two methods of behavioral therapy prove most effective. Those include applied behavioral analysis and occupational therapy. According to an article on Autism Web, applied behavioral analysis is based on the premise that appropriate behavior, including speech and academic skills, can be taught through scientific principles. Children receive rewards through positive behavior. For example, to practice imitation skills, a child may be asked to tap the table in front of them. If he or she does, they get a snack or a toy. If not, the therapist tells them no and then waits to try again. According to the U.S. Surgeon General, 30 years of research demonstrated the efficacy of applied behavioral methods in reducing inappropriate behavior and in increasing communication, learning, and appropriate social behavior. Autistic children often lack enough attention span to create day-to-day tasks. Occupational therapy provides children with skills to carry out everyday functions such as getting dressed and feeding themselves. Oftentimes, autism affects a child's fine motor skills, which leads to poor penmanship and hand-eye coordination. Occupational therapy uses special exercises such as bouncing a ball to build muscle and solve these problems. Psychostimulant medications attempt to treat the target symptoms of autism to keep them focused throughout day-to-day tasks. Methamphetamine serves as the most popular drug. However, others include phenylalanine and amphetamine salts. These drugs affect serotonin functioning, the dopamine system, and norepinephrine functioning. Medications that deal with serotonin and dopamine have proved most effective. According to one study cited in Stimulant Medication Treatment of Target Behaviors, impulsivity, disinhibitions, and seizures were all improved in the majority of children, and only 16.4% of children reported a side effect. Although medication may not be enough alone, prescribing it along with behavioral therapy would enable more children with autism to live normal lives and have stable relationships. Dietary intervention divides into two approaches as well. Those are adding a vitamin supplement and removing gluten from the diet. An article entitled "Effective Vitamin Mineral Supplement on Children with Autism" stated that according to 539 physicians, vitamin supplements are among the most widely recommended therapy. In a double-blind placebo-controlled study, 141 patients received vitamin supplements. Pre- and post-observations revealed that patients absorbed the vitamins well, leading to a significant increase in their health. For example, the increase in vitamin C led to a decrease in oxidative stress, greatly benefiting the child's learning ability. The gluten and casein-free diets, however, do not get the same amount of positive results. Though some children may see progress in eye contact and social interaction, the general consensus shows no significant improvement. Science Daily reported that on an extremely controlled study with the University of Washington, removing gluten will have no impact on behavior. Study participants had little change in activity, attention, and sleep patterns. This is due to the fact that the children on these diets may receive inadequate amounts of vitamin D and iron. No matter what the treatment types, a child can see great benefits. When he or she receives a diagnosis of autism, a parent should not lose hope. Several treatments can help a child go through their school years as normal as possible. Seeking medical help and finding the best fit for each child can work wonders. As years pass, medicine will continue to improve. The importance of this research becomes becomes apparent as it reveals that children with autism can look forward to a decrease in symptoms and finding their place in society. Thank you.